Hey everybody, Saul Marquez with the Outcomes Rocket. I want to welcome you back to the podcast. Today I have a friend on the podcast. His name is Jim Trounson. You guys have had him on the podcast before. You've heard his story. Jim, good to have you back.
Hey, it's nice to be back, Saul. We go back quite a ways, and I love what you're doing with the Outcomes Rocket. Looking forward to catching up with you a little bit this morning.
Likewise. And so, folks, for those of you that don't know Jim, I'll give a quick introduction on him. Jim is a visionary with an impressive track record in healthcare, and his journey spans over 5 decades, and it's a testament to his commitment to improving healthcare and people. He grew up in Idaho, and really, was the school quarterback, then went into the Army, became a hospital CEO, started a management company, grew it very successfully, and now he is doing something really cool. He started a group called Medvale, and Medvale is the first virtual health delivery network club of people that really is comprised of very successful CEOs, executives, and it's a group that I've seen him start and grow. So today we're going to be focused on talking about this concept of Medvale and what he's doing and how it can make a difference in your life by creating tribes and communities. So, Jim, so grateful that you made the time to talk about the work that you're doing at Medvale.
Well, I love talking about Medvale, Saul. So thanks for giving me a podium for that. And when I sold my physician practice management company after running it for 40-some years, I had the opportunity to think about what I wanted to do for the rest of my life. And I'm obviously an old guy. In fact, tomorrow is my 76th birthday.
Wow.
So
happy early birthday, Jim. You're a young
thank
man.
You. Well, I think of life's phases kind of like a software version of 1.0, 2.0, 3.0, and where our 1.0 version may be the first third of our life, where we're trying to create and find our identity, going to school, getting married, figuring out where we're going to live, picking a career. And then the 2.0, which is just a lot of responsibility, is when you are doing it all, raising the kids, paying the home mortgage, throwing yourself into your career. And then 3.0, which I'm doing now, is whatever is after your 2.0. So and I think of that as freedom, and it ought to be the best phase of your life, but we just don't do a very good job of planning for it like we do maybe our 2.0. And so when I had the opportunity to kick back and think about life after running companies, healthcare companies, realize I like connecting people. And so I'm just so fortunate I now have a job where I do that. And, I looked around, what does the world need? What's going on in healthcare? What do I like doing? And this idea of a community came to mind. I was happy not to have a lot of employees and not the stress of running a company, but my work here is not yet done. I love healthcare. I want to be very involved in it. I want to do more. I want to give back. And so I created the opportunity to do that while, here I am in the spare bedroom of my home, which I really like that kind of a work environment, but I need help. I want to do things with other people that can leverage what we might do. So Medvale is kind of like a community. We don't have any employees. but we have 48 of us. It's a small community. And so, Saul, as you know, I'm from this little town in Idaho of about 1,000 people. And that was just such a fortunate place for me to grow up with people who knew each other, who could collaborate, who supported each other. And so everybody's got a community out there. It's pretty fashionable. So I thought, how could we be a little bit different? So I talk about it as a little town, like my little hometown. And it helps to maybe visualize some different kinds of abstract concepts, like online library, like meeting virtually. So we have things like shops. We do have a library. We have a radio station. We have a newspaper, and anybody else would call them something else, but we're calling them things that remind me of little Wendell, Idaho. And we're trying hard to be small. This is kind of bizarre, but I think that's what they differentiate us, is that we are intimate, we're exclusive, we're hard to get into, we're by invitation only. So, for example, we're never going to be more than 150 Medvaleistas. That's what we call our citizens. And because that seems to be the maximum size of a hunter-gatherer tribe, or a lot of other entities that want to make sure they know each other and have accountability. Because when you get above that, other factors factor in, like you need regulations and you need policemen and that kind of thing. So trying to celebrate the idea that we're being small, and it's working. We could have quite a waiting list, and where all of our clubs are full, all of our seats in our clubs are full. And so I'm offering any Medvaleista $1,000 to leave our community, because we've got people who want in those seats. And so it's kind of a strange way to build a company, isn't it? To try to get people to leave or to buy them out. But I think it's maybe making us kind of special.
I'm a big fan of the idea of, hey, if the crowd is going one way, go the other way, because you probably don't want to go that way. Or even this idea of, hey, when the gold rush happened, everybody rushed over to the West. And, really the ones that did sort of take advantage of the gold rush were the people selling the shovels and the jeans and the hotel keepers. So what are you guys doing? As you're listening to this, are you following the crowd? Are you after the latest fad? That may not be where your health and wealth resides. And Jim is sort of a testament to that. Jim, what would you say is one of the things that you're most proud of, from the Medvale community and the things that you guys are doing?
It's the quality of the Medvaleistas, the people that get it and say, "Oh, I want to be part of a community." And let me just give you an example. We'll call her Jane, of a potential Medvaleista. This is a bit of an amalgam of a lot of stories that I hear from our Medvaleistas, but I think it's pretty representative. So there's this Jane, a hospital CEO, that's doing very well, and she is on the top of her game, very well respected on all kinds of hospital state committees. But one of her friends from business school, we'll call him Gordon, says, Jane, there's this community, this little town of Medvale virtually that I'm a part of, and you ought to take a look at it because I didn't think I needed it. But once I got into it, my life has just gotten to be so much better. So Jane takes a look at our website and our manifesto and says, this is pretty interesting. So she applies and gets accepted into Medvale. Within a week, she is attending a club meeting with 8 other bespoke members that are in similar positions. For the most part, our Medvaleistas are CEO level healthcare leaders. And all of a sudden, she's got connection with people that she never thought she could get connected to. She's got this safe place to go and talk confidentially about the challenges that she has, about some of her own vulnerabilities, and it's all confidential. So she really looks forward to the hour and a half that she spends at a collaboration, is what we call our meetings, because that's what we do. We collaborate, and she's got peers that she can talk to in a way that she can't talk to her board members, her employees, her coworkers, or maybe even her spouse, and looks back at this and say, what a fortunate referral this was. I didn't know I had such a need for a mastermind group, a peer support group, and is so important in my world now. So I would say it's that kind of intimate, confidential place to have brave conversations that she leaves a better version of herself after every one of our monthly virtual meetings. And her hospital staff likes it because she's connecting them with different resources and ideas, comes out of our meetings with some things that she thinks her senior leadership on a team ought to talk about.
Sometimes you want to get away from the big crowds, and not get to those big meetings, or maybe you've lost, the meetings that you're a part of have lost their luster, and you're looking for something more special, something more dialed in to your level. Maybe you feel the things that you've been doing are diluted. Well, that's not happening at Medvale because they're definitely, high caliber and very, very selective group of people. I've had a chance to meet many of them virtually and also in person. Actually, last March, Jim hosted a very cool dinner at the Next Med meeting. He had a group of executives from across the healthcare space, and we all got together for dinner. And it was a really fantastic conversation. I left inspired. We did a podcast on the spot there. It was just a group that was really cool, and certainly I'd say if you guys run into Jim while you're out at these meetings, because he does tend to attend, a lot of the innovation meetings in healthcare. Make sure you shake his hand. His badge will say Mayor of Medvale. Right, Jim?
The CEO level healthcare leaders right now are feeling actually kind of lonesome. They may not admit to that, but we're in a disconnecting world, and they so appreciate the opportunity to connect with like-minded peers. And let me give you an example of how we're helping them. We have a product that we call dolphin tanks. And so think of it as a shark tank, but we're smarter and we're friendlier. And so a Medvaleista will have some gnarly problem, maybe about a strategy or something that's not going well. And so they will bring it to a cohorted group of our Medvaleistas that know about that problem or who have been there before. In fact, we have a whole tier of Medvaleses that are 3.0s that have left their 2.0 job and are doing their consulting through Medvale. And so they'll sit with these very smart, accomplished healthcare executives and describe a problem that maybe they can't, again, talk to their own board of directors about or their own colleagues. They can come into this safe room, if you will, and kind of let it all hang out and get some help. We'll give them a mentor from our 3.0 tier that will follow through. So it's a, we don't even want to call it a consult. It's more of a way of helping. And so what does Medvale do? Maybe to get it even more simplified is we collect well-meaning, nice, humble healthcare influencers that can set strategy and implement that strategy to help each other. So Medvale itself doesn't do a lot of help, frankly, but the Medvaleses help each other like they would in a little town. And so that is really taking on. And I think because we're small, fairly new, we were born of COVID, that we could celebrate that, do things that you wouldn't find at a healthcare conference or maybe a hospital society or a medical society, but we can be very high touch. And so it's not like we're anti-technology, but I think people are kind of tired of talking to bots and having a hard time getting a connection. So Medvale is, you talk to a human being if you've got a question, and then we put you in touch with another Medvaleses, and we think that we're getting to like 2 degrees of separation from anybody in healthcare you want to talk to. If that person's not a Medvalista will know that person. And because we're a tight little town, we'll get you in touch. So I brag about Medvale as being a survey-free zone. You don't have to fill anything out. It's all one-to-one conversations for when you need help. And then our clubs are 8 people. So that's pretty small. Then you become, that club becomes like your personal advisory board. Because I thought, Saul, that when I started this, since they all are in healthcare, in fact, let me just back up because it's not everything in healthcare. It's healthcare, it's health delivery is how we differentiate ourselves. It's pretty narrow. It's not pharma, it's not biotech, it's not devices, even though what they do is wonderful, but that's a different kind of conversation. We can go deep quickly because we are talking about how to better do patient care. And we just go to the quadruple aim. Our version of it is we are going to help our members, our Medvaleses, to move one of those or several of those 4 dials of improving the population, improving the health of those specific population, improving the patient experience, reducing the costs, and now improving the provider experience. We're finding out we got to do that at the same time. So, I'm having more fun than I ever had before. And I've had just a blessed life. I've been so fortunate to be in healthcare for the first place. I've been exposed to opportunities. I love the people that get drawn into healthcare. I want to work with them. I like doctors. I want to help them. I'm not doing the magical things that they can do, but I can help them to do those.
Yeah.
By touching a lot of people and backing them up. So it's a good life.
Yeah, and you've done really cool things like fly your plane around the world. You have had a very interesting life. And folks, I've had a chance to get to know Jim pretty well. We actually crossed paths, but didn't connect at TEDMed several years ago in California. Then we connected. Jim flew into Chicago where I was living at the time, and we haven't looked back since. So good partnership, good connection. Jim, I'm so glad that you made the time today to talk to us about the work that you do in the community that you're curating with Medvale. Any closing thoughts that you'd like to leave us with? And then what's the best place for listeners to get in touch with you if they're curious about joining?
I've got an email that's probably pretty easy to remember. Jim, we're a first name basis company. Jim at Medvale, MEDVALE.com. And I do read my emails. So if you got an idea where you may want to look into our little town, would love to talk to you. And so I want to acknowledge you and the important work that Outcomes Rocket does. This has been a real inspiration to me. You've got your own community going, are doing important work to connect ideas, connect people. So there's a lot of parallels, and I'd like you to acknowledge to your listeners, your viewers now, that Fall's been a mentor to me. How fortunate for me to have a mentor who is almost 40 years my junior. And so thank you, Saul, for kind of bringing me into the real world and inspiring me with so many good ideas that you're out there on the leading edge to do. But I would just say,
Jim, I would say, by the way, I would say that I've learned more from you than you from me, but I'll take that. Thank you.
Yeah, we're going to disagree about that. So I think I'm the net beneficiary here. But just in closing, I think that a lot of wonderful health influencers can actually get more impact if they collaborate with others. And it's hard to do right now, again, in this disconnected world. And so, as I say, Medvale is the antidote. We can help you to do that.
Awesome, Jim. Well, listen, thank you for sharing your vision and the work that you do at Medvale, the community you have there. Folks, check out Medvale, medvale.com. Reach out to Jim, jim@medvale.com. Certainly take action. You don't want to stop at listening. You want to take action if something today resonated with you. Jim, thank you for being with us.
Thank you, Saul.